Trump, a boomer, wants another baby boom. Measles hits a new high, and the Senate would like a word with RFK Jr. This is America Dissected. I'm your host, Dr. Abdul and Katelyn.
And I'm your co-host, Dr. Katelyn.
And we're recording this on Tuesday, April 29th at 2 p.m. Eastern Time. Let's start with Donald Trump's newest idea to ignite a baby boom in America. He wants to give $5,000 baby bonuses if women have children. This is his idea to increase the U.S. birth rate, which has been dropping for some time now. Currently, the average number of children born to each woman in the U.S. is 1.6. And just do the math, you kind of need 2 babies born to each woman so that we can just maintain the population moving forward. That 1.6, by the way, is down from 3.7 in 1960. Katelyn, so do we think that $5,000 is enough to get people to have babies in one of the most challenging moments in American history?
Yeah, I was very curious. This conversation was unfolding very quickly last week, and I actually wrote about it on YLE. So I did some homework. I'm like, globally, if we pay families to have children, is it yield positive results? And it's actually really interesting to me that there's actually a ton of mixed results around this. So in Russia, for example, payments of $10,000 did increase fertility rates by about 20%. However, in other places like Canada, and it was like the 1970s, had similar efforts and really no long-term increase. I think that so that's my scientist hat, is there's mixed results. And then I put my mom hat on, and I'm just like, this conversation about declining birth rates, it just feels so disconnected from reality, because if we want people to have more children, it's not rocket science, right? We just need to create a society that actually supports parents. And that is not happening in the United States. I don't care if you're in Texas or in California or wherever you live, we're just nowhere close, right? We don't have access to affordable care, even infertility treatment, but also just access to OBGYNs. There's very little support for new parents, right? No paid maternity leave. In Texas, I had zero paid time off unless I used my sick leave. A lot of my friends had to go back to work after a week after giving birth. I'm not even joking. And then raising a family is daunting, right? Child care costs. My bill for my kids' childcare, I love them so much, is as high as my mortgage right now. And there's just this climate of fear, right? US has one of the highest mortality rates in the developed world. We are having now in some states the fear of criminalization after a miscarriage or a pregnancy complication. And so just thinking about pregnancy comes from a place of fear. It comes from a place of judgment sometimes, and now potential punishment. So, okay, I need to get off my high horse, but I guess I'm just very frustrated that we're trying to find quick wins, like a $5,000 baby bonus, rather than fixing the structural issues that we have in the United States and desperately need to support families. And guess what? If we build a society where families can thrive, everything else, and maybe even including birth rates, may just follow. And I don't think that's a hard conclusion to make here. What do you think, Abdul?
No. So I want to call out a really great program in Michigan called RX Kids, founded by Dr. Mona Hanna-Attisha, and we've actually had her on the show to talk a bit about it. So I love the idea of paying moms and families. That's fine. But to pretend that that's going to solve the problem of natality, that to me is nuts. Because we're both parents. Having a child is an act of hope. And when people stop having children, what it tells you is that there's just not that much hope. And you think structurally in people's lives, if you're a young person these days, you are graduating possibly high school, possibly college with huge amounts of debt. The possibility that you are going to own a home seems so distant, right? The ability to sort of set yourself up on economic footing where you feel like you can bring a child into the world and take care of them, as you've talked about, whether it's the cost of childcare, it's the cost of groceries, it's the cost of housing, it's the world that you're bringing them into. These things just are so difficult to attain for so many people. And it's the insecurity of feeling why would I bring a child into this world in a moment when I don't know that I can actually afford to give them the life that I want. And, just simply put, you ask the number of people, do you think your kid is going to have a better life here than you did? And if that's not the crystallization of the American dream, I don't know what is. And there are a lot of families who look at that and say, yeah, I don't know. And so if we're serious about making this a place where people want to have more kids, you have to make it easier to live your life and then to believe that your kid's life is going to be better than yours. So yes, $5,000, great. Like I think it's great. Give people $5,000, give them more, but also
it'll pay for a crib.
Yeah, right. Make sure it's structurally possible to dream about the kind of life that your kid's going to lead. And maybe then people will have more children. And that's, the other side of this is like all of us have parents, right? And as you think about this idea of providing care, there's this idea of a sandwich generation. So what happens then in a world where you have to think about taking care of your kids and your parents at the same time? This gets really challenging over time. I want to get to the story of measles here because, we've been watching this since the beginning of the outbreak, and now we are breaking records for all the wrong reasons. The current outbreak in Texas is now the single largest measles outbreak in the U.S. since 2000. We're now at 884 cases, 646 in Texas alone. Kaiser Health News recently surveyed Americans about the measles outbreak, and they found that half of U.S. adults are at least somewhat worried about the outbreak that we're experiencing. And as you can imagine, the degree of worry is split on party lines. 3/4 of Democrats say they're worried, and about 1/4 of Republicans say they're worried. I want to jump in on this, Katelyn. How do we get more people to care about measles? Like, it's kind of crazy to me that your body doesn't know the difference if you're a Republican or a Democrat. Like if you get measles or your child gets measles, why do you think that this is so politicized in the way that it has been?
Yeah, I mean, look, I try to listen to all viewpoints around this. And what I'm hearing is that, no, they don't. It's not that they don't think measles is bad. It's not that they don't think that they necessarily like what's happening and putting kids at risk. I think the disconnect here is, at least what I'm hearing, is that they don't understand why public health officials are raising alarms because this outbreak is so quote unquote small compared to other public health things that are going around right now. Opioids, for example, right? 90,000 people are still dying a year on opioids. And so they point to that. And I know I talked about this last week, but they also, a lot of people point, including RFK Jr., pointing to what Europe is experiencing, right? Tens of thousands of measles cases right now. And so I think what the disconnect is not necessarily that measles is bad. I think the vast majority of people agree with that. It's around a disconnect between the alarm and what they're seeing. And I think so because of that, I think public health has to do a whole lot better at communicating that we're not just worried about measles, but we're much more worried about what measles represents and what path we are going down, because we all see measles as the first building block of this path being crumbling. And so I guess that's how I'm thinking about it. Abdul, what do you think?
I think you're right. Like one should always come at an issue from a position of empathy and a position of engagement and a position of listening. That being said, the degree to which I saw the current president weaponize the issue of immigration, like somehow some undocumented person was going to come to your house and specifically assault you, to create a huge issue about safety at the border, suggests to me that there is a inconsistency in terms of the degree to which there are real risks and perceived risks. And so you're right that there are other big public health issues. Why make a big deal out of this one? Well, there are other big political issues like, I don't know, our economy's tanking. Why make a big deal about what's happening here? I worry that too often we are willing to allow politicians with very particular goals to set agendas that may not actually be consistent with what the level of challenge that we face is and what we can do about it. Right? The thing about measles is it's perfectly preventable. Right? We're still worried. All of us are still worried about the overdose epidemic, and we're trying to get a handle on it, and we're working really hard to do that. But the degree to which that is as preventable as measles is just not consistent. Like we were in a world where measles did not really exist in any meaningful way. And then a bunch of folks started to, whisper sweet nothings of disinformation into our ears. And now all of a sudden we're dealing with an outbreak. And so I hear you, like, and I agree, you're right. Like the way we handle this is exactly what you said, but it's hard for me to hear folks talk about, well, why this issue and not the other issue? Because you could play that game about any issue, right? And I think there's very clear reasons why this one should not exist, but for choices that people are making, right? It does not have to. And so, I worry that I just think it's really important to continue to make an argument about the fact that, there are a lot of people who want you not to pay attention to this other thing because they've got stakes in making sure that you listen to the disinformation on the other side. It just so happens that, they are now very powerful in American government, and we're all living in a world that they have created for us. And I think that's my frustration.
Yeah, I mean, and I hear that. And I think that the way that I have at least been trying to approach the last 100 days, I can't believe it's only been 100 days, is that there's a difference between what I expect and what I empathize on the ground with like other moms and individuals in our communities versus what I expect from politicians. And I am very much aligned on pushing RFK to say that MMR vaccine works. I think he has a ton of power right now. A lot of people are listening. I also think that listening and meeting people where they're at and their places of concerns on the ground is also important. Doing those both well at the same time is incredibly hard. We're also in this moment that we have to do these hard things too. And so I don't know. It's, I think that this measles story is going to make a whole lot of news in the next 2 months when we hit that threshold that it's the highest number of measles cases in the past 25 years. It does force a conversation on why we're moving backward instead of forward in this moment.
America Dissected is brought to you by the de Beaumont Foundation. For 25 years, the de Beaumont Foundation has worked to create practical solutions that improve the health of communities across the country. The foundation advances policy, builds partnerships, and strengthens systems to give everyone the opportunity to achieve their best possible health. To learn more, visit debeaumont.org.
All right, potentially good news, Abdul. We have good news. Senate Health, Education, Labor, and Pensions Committee, it's called HELP for short, wants to talk to RFK Jr. What do we know about this meeting, Abdul?
It seems like accountability is not dead. That's great. It seems like Congress is alive. It's a co-equal branch of government.
Well, they woke up.
Yeah, I know. It's been a long sleep. All right, they just wanted to take that 100 days off, but they woke up, realized that all was not well in the world of HHS. And just some context here. Remember, Bill Cassidy was one of the deciding votes to confirm RFK Jr. earlier, and I think he's trying to save some face here. Way back in early April, just as DOJ was firing a large proportion of the HHS workforce, Chairman Cassidy sent Secretary Kennedy a letter asking him to update the committee on the restructuring at HHS. He actually wanted him to appear on April 10th. Kennedy didn't respond at the time, and this May meeting appears to be in response to the initial request. That being said, HHS released a statement that said, quote, "The Secretary looks forward to appearing before 6 committees on the President's budget in May, including the HELP Committee," which implies that RFK's HELP testimony is just part of the normal budget process. I think it's important for all of us as we watch this to recognize that it's hard to disentangle a lot of what's happening from the inside and the inner workings of Republican Party power. As Trump goes into 100 days, his approval is historically low. And I think you're going to see a lot more Republicans in Congress being willing to pressure the administration on some of what's been seen. That, coupled with the fact that Elon Musk has announced that he's finally leaving the federal government to go and save his car company, which is on fire. And so it's going to be interesting to watch how these lines of questioning may move. Katelyn, I want to just take for a second. Let's assume a few senators on the HELP committee really do want to take on RFK. What would you suggest they ask him?
What's the plan? I still haven't seen a plan on what's happening with AHA, how things are moving, why they're cutting where it's going to go, how are all these things going to work? I just want an understanding of what's going on. And I think a lot of people are, not only within CDC and FDA and other branches of HHS, but also at a state and local level. Without any sort of transparency or any sort of execution plan, people can't figure out what's money is going to be coming in, what they can plan for, what they build a moat around for core capabilities or not. And so I guess that's my number one question is like, what is your grand plan here? Or are you just going on vibes? And so that gets down to like restructuring questions, thinking about critical HHS departments that should be restaffed. And if they're being restaffed, if they made mistakes. For example, we all remember that Kennedy fired or let go the lead poisoning team at CDC, and apparently they're going to get their jobs back. It doesn't sound like they got their jobs back. Are they going to go back at CDC? And so a lot of clarity on a lot of this whiplash we have seen. I would love for them to ask about the measles response. What are you doing as HHS secretary? How are all of your very big branches of government helping with this response? And then finally, I have like a billion questions around this HHS budget that got leaked last week, because there's, again, a ton of cuts. I mean, we're talking about 40% cuts to CDC on top of everything that's going on. And I just don't know if CDC can actually function as an agency for American people that has been so stripped away from resources and capabilities and staff. So I guess that's all on top of my mind. What am I missing, Abdul?
So I would want to really identify those cuts that affect the things that RFK Jr. has said he cares about,
Yes.
right? So if you say you care about autism, why did you gut research on autism at the NIH? If you say you care about chronic diseases, why are you trying to throttle the research of the lead researcher on ultra-processed foods, so much so that he decided to leave, right? I really want to understand that line of reasoning. I think the other line of reasoning I would like to push him on is, why did you reorganize to give yourself so much more discretionary power, right? In the past, you had better qualified HHS secretaries who understood that these agencies did a really great job making decisions based on the best available evidence. It seems that you are trying to assert unilateral power over programs by reorganizing around this like AHA initiative, right? Which doesn't really mean anything. And then what do you plan to do with it, right? If you want to give yourself that much power, then the question becomes why? Like what is your goal here? What should we all be paying attention to? And then also, why are you making these decisions unilaterally without consulting any of us in the first place? Why did we have to summon you up, right, to come tell us what you were doing when these are functions that are congressionally mandated? So I'd love to see them really, really push on some of those points of power accumulation and those points of inconsistency with what it was that he said he wanted to do. I did want to jump in on this lead issue, right? Because I really appreciate you highlighting both in your local epidemiologist, which, by the way, if folks are not subscribed, you should go to your local epidemiologist on Substack and subscribe. That, my friend, is how you do sales.
Yeah, it's really embarrassing.
Anyway, but you've been sort of focusing on this point of inconsistency, right? I think one of the things that's a through line with this administration is they're really good at understanding how the media process works, which is you get a story, it bubbles up, and then it's no longer news, and so you forget about it. And they're really good at just waiting things out by giving excuses. But this lead story, the CDC, just keeps coming back. And I want to just offer an update on this, because you might remember that Milwaukee Public Schools literally reached out to the CDC for support on an issue that they had with lead in their buildings. And the CDC basically responded and said, we can't really help you because, I quote, sorry, that program has been cut. Now a total of 9 schools in Milwaukee, in Wisconsin, a critical swing state, may I just remind you, right? Politically, like, this is not the place you want to mess up if you're them. 9 schools have been closed. School officials had wanted to use a program called EpiAid, which it seems the CDC cannot send out, which would have comprised of a team of epidemiologists to come support. Democratic lawmakers in Wisconsin have asked RFK Jr. to reinstate the program. We don't know if he will. And the city school district and health department are in the process of trying to inspect 100 buildings. I'll tell you, when I was at the city of Detroit, we had every school, daycare, and Head Start tested for lead in the water. We found that an astonishing number had lead in their water. And you know who he talked to back then when the CDC was still functioning? The CDC, because it existed and they had a program that could support us on this. And so, Katelyn, what does this story teach us about where this all might be going?
I don't know, honestly. And I guess there's a lot of confusion I'm having because we still have epi-aid programs. I mean, they're responding to the measles outbreak right now. So I guess my biggest question is, this is like a philosophical question, is like, what is the job and scope of CDC? And if we're moving towards what it seems like is a data agency as well as an infectious disease response agency, which I could see an argument for that, it's very unclear where all of the scope of everything else, including this lead team, belongs. Because infectious diseases aren't the only thing that impact communities, that aren't the only thing that have emergencies. Take another example like the Ohio train derailment. Epi-aid went to that. That is not an infectious disease. That's an environmental disaster. We don't have an environmental team right now to respond at CDC. It's gone. And so this goes back to the sort of questions I really am craving, that I genuinely have questions about. Is that like, where does all of this belong and what's the plan? Because I have not seen any of that. And I think that confusion lies at a local, a state level, as well as employees in the federal system.
Yeah, I think it's a really good point. It's, to use an analogy, you can imagine a bus line, and you have buses, but that you gutted the coordinating station. So now the buses just sort of sit there because you don't have the wherewithal to coordinate them where they need to go and to manage that resource. And we take for granted that a lot of the overhead in government is about doing exactly that. It's about managing information and coordinating resource flow. And when you gut that, you may have the resources, you just can't get them where they need to go. So, Katelyn, we had a very stimulating conversation. A couple of weeks ago, we talked about a recent book called In COVID's Wake, written by two political scientists at Princeton. And we invited them to come on. They very graciously did. And we just finished up that interview. What are your take homes from the conversation, Katelyn, that you want listeners to pay attention to?
I mean, Abdul, I think honestly, truly, more of these tough conversations need to happen, like period, across every topic in the American world right now, because these conversations aren't happening. So one, I'm so appreciative and honored that they answered our email and wanted to come chat with two epidemiologists. First of all, I appreciated that. Second takeaway was, we're going to have to agree to disagree on a lot of these things. I think that there is inherent differences in where we stand, where we were during the time, and which influence our perspectives as well as our biases. And I think that I was proud of us showing up, telling our truths and listening to theirs. And so I guess that's where I'm at. What other takeaways did you get, Abdul?
Yeah, I agree with you. The tough part about working in this field is it's not academic. Like,
Yeah.
It's and actually one of my big frustrations with public health is that it has become too academic.
Yeah.
Right? Our job isn't to show up after the fact and tell you what happened. Our job is to be there on the ground when it is happening and make really, really tough calls. And, we have a term for that, which is called, Monday morning quarterbacking. I guess here we'll call it 2025 quarterbacking, which is, like 5 years ago, we were really faced with a difficult situation. And there is very reasonable criticism about the decisions that were made in the moment. But I do think that it's important for us to recognize that when you're facing those situations head on, you don't have the perfect information of hindsight. It's a lot harder to make those calls than it may seem in hindsight. I'll also say I'm really grateful for them coming on. I think that they made some really important points in their book, particularly around some of the social media bullying that was happening, the ways that the polarization of our society made it really, really hard to have like a coherent policy or public conversation about this. So there's a lot of points of agreement. And at the same time, part of me says, I just would like to have this conversation with a little bit more grace for how tough it is. And then more importantly, context about the fact that this is not the last pandemic. And so I don't want us to overlearn the lessons of the last one, lest we make mistakes on the wrong side of things. And too often policies are like pendulums, right? You get it wrong on both sides every single time. And We just got to remember that like a lot of people died during COVID. You coined this idea of pandemic revisionism. And unfortunately, right, it's too easy on both sides of the political debate, right? Yeah. Republicans don't want to talk about this because they want to pretend it never happened. And Democrats don't want to talk about this because it doesn't help them to talk about it. So nobody really wants to have this discussion. I'm grateful that these two professors came on to allow us to have the conversation together. I learned a lot from their perspective, even if there are points at which we disagree. All right, on to that interview. Katelyn, where in the world is Katelyn? San Diego?
Nashville.
All right.
Reporting from Nashville hotel room.
Have some hot chicken for us.
I will. It's humid here. Is this how the rest of the world lives?
Yes, unfortunately, it gets humid in the summer in other places. In fact, the weather changes in the summer in other places, Katelyn.
I'm giving you a hard time. Yes, it's absolutely beautiful out here. So I'm glad to be here.
Well, always good to share some space and time, and we'll see you next week.
Bye, guys.
America Dissected is brought to you by Ground News. You got to imagine I spend a lot of time reading news, and if you're listening to this pod, I'm sure you do too. As the news ecosystem has exploded with all kinds of news sites and aggregators and newsletters popping up, it's hard to get a sense of what you're reading and whether or not the author or publication has any sort of agenda. That means that it's really hard to trust anything you read at all. Too often, folks are writing to others in their own ideological bubble, and you end up getting captured by this algo or that one, without having a sense of what the broader lay of the land looks like or being exposed to other perspectives you might not be getting. Thankfully, there's a way to escape these echo chambers of ideological reinforcement, a platform that helps you see every side of every news story. It's called Ground News. Ground News is a platform that makes it easy to compare news sources, read between the lines of media bias, and break free from algorithms. Ground News puts you in a position to choose and to compare the news you want to read, while giving you a peek into what's being reported on opposite sides of the political spectrum. With all the news coming out of this White House, it's worth understanding both what folks who might think like you are hearing and what folks who may not are too. I don't want to miss my blind spots, and that's why I love Ground News' blind spot feature, which specifically compares headlines across the same issues. For me, it's absolutely critical to gather all these perspectives as we prep this podcast, making sure we can fully articulate the perspectives we bring within the context of everything that's being said. That blind spots feature is just one of the really valuable resources that Ground News offers. With Ground News, you get details about the sources of your information, including if the news outlet has a political bent, how reliable their reporting is, and who owns them, empowering you to compare how different news sources from around the world cover the same story. With over 9,500 five-star reviews of their app and website, Ground News is the #1 platform to discover how any news story is being covered, giving every perspective all in one place. Expand your views of the news, sign up for your Ground News account today, and get access to the mobile app, website, browser extension, and exclusive newsletters so you can have a well-rounded view of the world, think critically about what you read, and find common ground between perspectives. Go to groundnews.com/AD today to get 40% off the Ground News Vantage plan and get access to all of their news analysis features. That's groundnews.com/AD for 40% off the Ground News Vantage plan for a limited time only. groundnews.com/AD. All right, can you introduce yourselves for the tape?
Hi, I'm Frances Lee.
I'm Stephen Macedo, and the thesis of our book is that we need much more careful consideration next time of the costs as well as the hoped-for benefits of measures like lockdowns and school closures, and more open debate about these matters.
Well, we really, really appreciate y'all joining us. I'm really excited for the conversation. Your book was one that really got our attention and got us thinking, and we were really excited when you agreed to join us for a conversation.
Yeah. Thanks, guys, for joining and talking to two lonely epidemiologists over here. I think that Abdul and I had a lot of learned experiences and learned lessons, and a lot of firsthand accounts. And so we are more than happy to have this conversation. Thank you.
Well, thank you.
Thank you.
So one question we had was just, it's helpful to understand sort of how each of us experienced the pandemic. I know I experienced it from my in-laws' basement, doing, really just interview after interview after interview, trying to understand what was happening, to read up, and then to explain. I know Katelyn's was somewhat similar. What was your lived experience of those first 3 to 6 months of the pandemic?
Well, I could say first that my experience was not bad, and indeed, I was not hypercritical or skeptical of the measures. I was working on other things and thinking about other things and sort of going with the flow during the COVID pandemic. There were things that I was not entirely sure about that were coming out of official messaging, including the doubtfulness of a lab leak of the virus. But I was not thinking like an academic, particularly about these matters. I had courses to teach online and conferences to go to and so on. So I was at this rather comfortable place that I am at the moment, and having meetings canceled was perfectly fine as far as I was concerned. I was only teaching a seminar online, and that wasn't bad either. So I have to say I had a kind of normal experience for members of the privileged laptop class, and in some ways I welcomed the peace and quiet. I'm sorry to say that, but it was obviously a traumatic period going to the grocery store, having the groceries bleached, and being concerned about carrying virus in your clothing and so on. There was a lot of anxiety for sure. But my experience during the pandemic was that of a fairly normal professional going with the flow and doing the best I could.
So I remember when we were sent home from the university at midterm in spring 2020. So I went back to Washington, D.C., where my husband lives. And, that was would have been the start of our spring break, but they announced that we wouldn't be coming back immediately afterwards. And so settled in. Now I had doubts about the effectiveness of the measures that were being taken. I could see that the virus had spread all around the world and all around the country. I mean, the news was coming in, making that entirely clear. And I'm thinking to myself, I just don't see how what we're doing is going to contain it. And so I just have these doubts, which are consistent with the sort of questions that I had asked professionally around questions about government policy, whether it's effective, whether it has unanticipated consequences. Those are sort of bread and butter questions for somebody who works in a policy school and teaches courses on national policy making. And so I had those doubts. I could see that a lot of other people were working in person. They had to for society to continue. And I'm thinking to myself, I don't know when we're going to be able to go back to the university or when things will reopen, because I don't see how this gets under control.
So I'm an epidemiologist, and I know that one of your guys' themes of the book was the criticism around politicians who didn't necessarily question epidemiologists and other scientific experts. And I'm curious that since writing the book, I know you guys have been doing a ton of speaking engagements too. Have you spoken with any of these elected leaders who made these decisions, and you would, have told you about the logic they used at the time and how difficult those decisions were from their political perspective?
I mean, I'll just say we haven't spoken to a lot of elected leaders. We've spoken to the public health official from Mississippi, and Francis can perhaps talk about that. We have spoken a bit to decision makers in universities who also had to make these policy decisions in those smaller settings. And, they were making decisions. Now, the ones we've spoken to are highly resourced institutions with a special, concern for the well-being of their own students, a lot of resources to spend, and also keeping an eye on what other peer institutions are doing. And obviously, those people, intelligent people, were getting advice and did what they thought was right for the sake of protecting their own students. These were not typical decision makers, the ones that I've spoken to, because again, we're talking about highly resourced universities with focused concern for their students in particular. But we understand that there was a lot of fear at the point of the decision making, and people were doing the best they could. We do think that it's surprising that people didn't pay more attention to the pre-COVID pandemic planning documents, which were many, and we're skeptical about the efficacy of these lockdown measures, as Francis was from the start. And we're emphatic about the costs of these measures, including for students and especially for students from poorer backgrounds. So there was, there were guidances out there And it's very surprising to us that the Chinese model wound up wielding such great influence as compared with the decades of careful study of the efficacy of these kinds of measures that was available.
I'll just say that our approach to writing the book was not journalistic in the sense that we didn't go out and systematically do interviews. We wrote the book on the basis of the public record, the data that we could compile, and the studies that were available. So it's an academic book that relies on those sorts of sources rather than on reporting.
I want to jump in because a lot of the book centers on the efficacy of non-pharmaceutical interventions. And just for listeners, what we're talking about here is everything basically. It's not vaccines or medications, right? We're talking about lockdowns. We're talking about masking. We're talking about stay-at-home orders, testing, right? These kinds of interventions. You make the argument in the book that there was a consensus about their efficacy or lack thereof. And I guess I struggle with that only because the efficacy of an intervention is really a function of how people perceive the disease to be, and frankly, the nature of the way the disease is transmitted. So it's helpful to me, at least, to recognize that we didn't know what we were dealing with at the time we were dealing with it. And so one could imagine that we were dealing with something like Ebola, right? Ebola is an extremely deadly, pretty transmissible, though not as transmissible, admittedly, as COVID-19, given that it's not airborne, but also a really scary disease, like the kind of disease that kills you because you are bleeding from your eyeballs kind of disease, right? And I imagine that if we were dealing with something like Ebola, and that happened to be the epidemic that hit, that if public health officials didn't say, lock down, protect yourself, stay home, people would think we were insane. And if we did say it, people would be a lot more likely to actually do it because of how scary Ebola is. And so it's hard for me to disentangle the efficacy of an intervention, or to think about the efficacy of an intervention in a vacuum, right? Or to disentangle it from the disease that we're talking about. And I guess, had we been talking about a disease like Ebola, right, I wonder whether or not you would still agree with the idea that these kinds of NPI interventions are just not effective from the jump.
Well, let me just make a couple of comments about that. One that Francis back in. We were getting some information from the Princess cruise liner that was quarantined in the Japanese harbor. Michael Osterholm was saying in mid-March that the virus is aerosolized and will not be possible to contain effectively. He was also pointing out that the measures would be extremely effective. We discussed in the book that there were quite a large number of dissenters from the policies. Eminent scientists, Tom Frieden, Greg Gonsalves, who later became a great believer in the lockdowns, were writing pieces in mid-March saying the Chinese must be getting bad advice. They're not doing the sorts of things that have been recommended before, and we could never make these measures work, bolting people into their apartments and so on, in the West. And the virus has already traveled too far. So, in fact, there was disagreement early on, and there were many that were pointing out David Katz of Yale, Justin Lesler of Johns Hopkins University. There were many that were pointing out in March, and we quote them in the book, making reasonable suggestions about the unlikelihood of the effectiveness of these measures and their costs. Of course, with masks, we had the Cochrane reviews that had been published for decades. Its fifth revision was scheduled for publication that spring, 2020, and it was postponed for various reasons having to do with some politics among the editors of the journal. But there was we admit that it was a bad pandemic. It was a bad virus. A certain amount of fear was totally understandable, but there was also an opportunity to learn, especially over the summer, and we're surprised that didn't take place.
I did want to jump in on the question of Ebola versus respiratory pandemic. That what we were looking to as far as pre-pandemic plans were concerned were those aimed at dealing with a respiratory pandemic. So, I mean, that was the planning that had been done in the George W. Bush years. That was also those are also the plans that we referenced from the World Health Organization in 2019, which so they were calibrated to questions about how to contain a virus, or how to deal with a virus that's transmitted as a respiratory virus. And that 2019 report goes through each of the proposed non-pharmaceutical interventions that had been suggested as possible responses, and lays out the evidence base around each one. And in each case, they note that the evidence base is weak, it's poor, and they designate some measures as not recommended under any circumstances in the context of a respiratory pandemic, and those were testing and contact tracing, border closure, and quarantine of exposed individuals. That all of those were seen as unlikely to succeed and having high costs. Even if we go back to the George W. Bush era planning, that's where you get the term, the early targeted layered non-pharmaceutical interventions. So why early? If they're not imposed early, then you can't have much expectation of success. And of course, we don't know here in the U.S., or in fact, even around the world, we don't know for certain exactly when this virus began to spread. We know that there's evidence of in blood banks from December 2019 that it was already here. So when you're looking at several months of spread before any measures were taken.
I think you take for granted that we understood that this was respiratory based on a little bit of initial evidence, because this was all at the same time that we were still wiping down our bananas. So I just want to be clear that you can argue that we should have used data about a respiratory illness, but we had very limited evidence about whether or not this was a respiratory illness. We had some evidence that was suggestive, but not all.
Yeah, I mean, I think I would like to insert an example, if we're talking about respiratory, that is measles. Right now, we use all of these interventions for measles transmission, and it's a highly transmissible disease, and it works. Quarantine works. Masks work against viruses at an individual level. And so I guess I'm having a hard time understanding how these NPIs are different, because we use these tools every single day with respiratory viruses. I think the other thing that you said, Stephen, was around that none of these conversations were happening. I mean, they were. I was in the room in Texas. We opened schools in August of 2020 in Texas because of a lot of these conversations. There was a lot of trust jumps. We had to make really hard fucking calls with very little evidence. And looking back, yeah, we pat ourselves on the back in Texas because we opened schools in August 2020, but it could have easily gone the other way, especially with stupid viruses that really typically impact kids a whole lot more than with COVID-19. I guess, so my question is, in the beginning day, let's say March 2020 to August 2020, what would you have liked to seen public health do if it wasn't implement NPIs, because that was literally the only tool we had at the time?
We're not epidemiologists, and a big part of the argument of the book is that there were grounds for a reasonable debate and discussion about these matters. In fact, there were different policies pursued in the different states. We talk about that. Francis can talk more about it. It became a very partisan pandemic. Yeah. Republican states opened much more quickly than Democratic states. There was certainly something to be learned from those states and their school reopenings, both there and in Europe, in the Republican states in Europe. And yet in many Democratic states, the schools stayed closed for much of the 2021 school year. We think that by that time, certainly by the fall, and even over the summer and so on, there was learning to be done because there had been schools that were open, and there should have been more open debate heading into the fall, and there was good evidence for reopening schools, certainly in the fall of 2020. A big part of the book is about the lack of debate, lack of critical discussion in many states. Texas, where you were, seems to have worked out much better. But in many parts of the country, there were not open debate, and there was intolerance of people that were dissenting and seeking to debate these matters. And that's a record that we show rather, I think, effectively in the book.
And we don't take a strong stance on the question of what should have been done initially. We don't really see that as our role, but we do raise the question about learning over time. And it was so striking how little effort there was to learn from the schools that were open in Europe in spring of 2020. They mostly reopened. And then when schools reopened in Texas and across the South and the Plains and the Intermountain West in the fall of 2020, why wasn't there a concerted effort to study those? And so that the schools on the coasts could have taken a lesson from what was happening there. There just wasn't that quest for information, recognizing that there was a lot that we didn't know about how to handle a crisis like this. It seems that we locked into a certain set of approaches and just kept pursuing those without a whole lot of interest in re-examining them.
And the debate here was much more polarized than in Europe, it seems. The Scottish epidemiologist Mark Woolhouse, who seems to us quite a sensible and well-informed person here, he actually supported the first lockdowns in the UK, and much on the same grounds that you all have, that something needed to be done. People were panicked, weren't sure. There was a lot of uncertainty, and he supported the lockdowns. He thinks in retrospect there's lack of evidence to show that they were efficacious, but he did support them at the time. But he's very clear about the learning that took place to a greater extent in the UK than here over the summer of 2020. Here, fears across the population range were fanned by the media, by efforts which also took place in the UK to make people more afraid. In many cases, it's very clear in the UK that the government advisory group sent emails to the BBC, which we have, saying that young people are not sufficiently fearful because of the low mortality rates in their demographic, and we need to ramp up the fear levels. We see that in some of the early books that were published about the COVID pandemic. Dr. Sanjay Gupta's book starts with 4 vignettes of people who got seriously ill or died of COVID, and they were very unrepresentative cases of people who were quite healthy, athletic, young, and so on. So as Frances says, we're not epidemiologists, we're not public health experts. We're reporting on decisions that were made on what appears now to be a highly politicized, partisan basis, and a lack of learning that took place in places that kept these measures in place longer. The costs of these measures, which were predicted to be very considerable, and which do seem to have shown themselves to be very considerable, the lack of evidence for their efficacy, and the ways in which democracy did not function very well under COVID. The need for critical debate was short-circuited, and scientists were not open to criticism in the way that scientists are supposed to be. Journalists were not questioning public authorities in the way that journalists are supposed to do. And we think that many academics as well have been too slow to ask questions about the effectiveness of the measures that were undertaken during COVID.
Yeah, I don't think either of us would begrudge you the political partisanship and the nature of the public conversation that had been disjunct for a very long time. It's also hard to disaggregate this from the nature of our governance at the time. America Dissected is brought to you by Our Big Shot, a new podcast series exploring one of the biggest achievements in human history, the worldwide effort of immunization. Hosted by friend of the pod, Dr. Seema Yasmin, Our Big Shot features accessible stories you won't want to miss. Too often, our conversations about vaccines feature tragedy, misinformation, and discord, but this podcast tells the story of something completely different. It's a celebration of the 154 million lives saved by the combined efforts of the human race. Dr. Yasmin, disease detective turned journalist, unravels the history of our struggle against disease and what that means for the future, and how we continue with the goal of eradicating disease. She has personal experience working worldwide with scientists, psychologists, communities, parents, and children with one mission: to wipe out disease. She brings her firsthand, clear-eyed experience through conversations from around the globe that both astound and inspire. The podcast series does not shy away from examining the many issues around immunization development, both from history and the present day, and it uses both to ask us questions about what we want for the future of science, social media, and ourselves. I love this show because Dr. Seema has such a unique perspective on this, and she's a fantastic explainer. Search for and subscribe to Our Big Shot, Wiping Out Disease on Apple Podcasts or wherever you get your podcasts. I do want to sort of step back for a second because, you sort of think about any medical or public health intervention, And if it doesn't work the way that it's supposed to work as a function of a failure to execute, then sometimes we second guess whether or not the intervention was right. So another simple analogy here is, a patient has classic signs of appendicitis, and the surgeon says, I need to operate. The operation goes poorly, and you can either say, well, it's because the operation or the surgeon didn't do a good job, which is possible, or it's because, well, maybe this patient shouldn't have had surgery in the first place. And the reason I raise this is because we did have examples of places where lockdowns were effective. They were short ranged. And then because folks were willing to follow very simple NPI recommendations, they did rather well. Like I think of Australia, which, from a political standpoint is probably as close to an analogy in the United States as it gets. I get there are a lot of differences, but very similar social norms and mores. And they did really well. And their approach was based on a society-wide collective investment in this kind of intervention. And I guess I wonder how you think about that, because I know that in our country, the way that this was executed was rough. We will completely grant the fact that this was inequitable in the way that it actually ended up turning out, because we called people essential that ultimately society was deeming expendable. And the consequences of COVID were extremely inequitable. But I just wonder, what if as a society we actually said, all right, this is the direction we're headed. We're going to do this in an equitable way. We're going to figure out how to minimally expose people to this virus. Do you think there's a world where we could have had a Australia type outcome?
I think it's very important as we take stock of what happened during the COVID pandemic to look globally and not to cherry pick particular examples. So if you're looking at Australia, Australia did do well. Island places did well. Japan did almost as well as Australia, even though Japan had border closures, but no lockdowns and no testing and tracing, to speak of one of the lowest testing rates in the developed world. So we have to take into account what we've learned from all these settings. There's a piece that came out in last summer in the Lancet Global Health Europe that looks at results across the 29 countries of Europe, and that piece by public health scholars at the University of Milan reports that countries with higher levels of vaccine uptake did better than countries with lower levels of vaccine uptake. But they don't find a relationship with the use of non-pharmaceutical interventions, the so-called Oxford Stringency Index, not in 2020, not in 2021, or in 2022. There were countries that had no lockdowns, like Sweden. There were countries that had just one lockdown, like Switzerland. And then there were countries with 3 or more lockdowns, some even post-vaccination lockdowns, and yet no relationship with the use of the NPIs. So I think we need a global look at what was done and what the evidence shows, and we have to avoid looking to preferred examples that sort of illustrate our case.
I mean, one other, example of that would be the debate around masking. Dr. Fauci has been in an interview recently, the last few weeks, which you saw, which was on YouTube somewhere, saying that yes, there is evidence that masks worked. And what he was talking about in the interview recently were N95 masks, very carefully worn, changed frequently, test fitted for individuals. And those were not the recommendations early on in the COVID pandemic, when people were recommending cloth masks and so on. So the evidence around masking has always been weak. Surgical masks are not designed to protect people from aerosolized viruses. And we think that debate was highly politicized. It became a symbol of, virtuous cooperation. And, I sort of understand that. I wore a mask too, and it became a kind of symbol of concern for others. But the evidentiary basis for it was very weak. Dr. Fauci was asked in 2019, before the COVID pandemic was on the horizon, what should we do in the event of another pandemic? And he immediately cuts the interviewer off and says, the interviewer says, should we wear masks? Should we? And he immediately cuts the interviewer off and says, no, avoid that paranoid stuff. Get a good night's sleep. Keep yourself healthy. Don't drink too much. Get some exercise. Just do the normal healthy things. So there was a kind of, realism about some of these matters that seems to have gone out the window. And of course, created a lot of inconsistency around the mask recommendations. And again, we don't have a prescription if that's what you're looking for, as to what public health should do. But we do think that there needs to be greater openness to a wider range of viewpoints. And as Francis said, at least an accounting of the absence of good evidence for the effectiveness of these measures in any consistent way around the world. In many cases, I don't think we understand particularly well. At least this is what we've learned and what we've told from some others. We don't understand the variation across countries altogether well. There's certainly variations in the way that countries count COVID deaths. In some cases, if you die with COVID, but with other conditions as well, it gets counted as a COVID death. In other cases, they require that the death certificate identify COVID as the sole cause. So there are different aspects to this that make it hard to assess on an international basis. But as Francis said, we lack evidence for good evidence of a consistent nature to show that these various measures were efficacious.
I guess, if I'm gonna follow up, and then Katelyn, I'm gonna hand it over to you. I guess that my frustration is that in the setting where we have come through one major pandemic and we have an N of one, albeit if you want to explode the data set out, you have an N of one multiplied by however many different countries. It's easy in hindsight to look back at decisions that were made and say those decisions were the wrong thing, right? It is impossible, based on what you're sharing and what I'm admitting, to understand why that variation existed. But in a setting where you're thinking about what ought to have been done in the moment where we had limited information, it is very difficult for me to second guess a lot of those decisions that were made. And we're not, defending NPIs as a matter of course. Like, we want to know the evidence just as much, if not more, than you do, because, those of us tasked in public health with this work may be put in positions where we have to make really hard decisions again. I think what's difficult to me is if you're unwilling to say what should have been done, even with perfect information, it's very difficult then to point at what shouldn't have been done with perfect information, right? So I just that's where I feel a little bit frustrated with the analysis, because in some respects, it you can cherry pick what is known to articulate what was wrong, but not articulate what should be done or what would be right in a moment with far less information than we have right now about diseases that may yet be coming. So that's kind of the frustration I'm coming with. Katelyn, what do you think?
Yeah, I think I agree, Abdul. We want solutions. The challenge is that there's a whole lot of complaining without pointing to solutions that we can use in the future. And, I think that it comes back to this idea where, and you guys talked about it in this group, around this elite consensus around MPIs after Wuhan lockdown, and that dissenters deserved a chance for their points to be heard, right? A great example is the Great Barrington Declaration that came out in October. But I guess I don't necessarily agree that they didn't get a chance. The Great Barrington Declaration folks were in the Oval Office. You guys are looking, we have pictures of the President of the United States really engaging with that group. So I guess my question is it possible that dissenters did get their chance, but ultimately did not make an effective case at the time of an emergency?
The message from Francis Collins to others on email, as we quote in the book, was about the Great Barrington Declaration. There needs to be a quick and devastating takedown. And that's what followed. Those arguments were not taken seriously in October. Now, the election was a month away, and I think politics partly explains it. Donald Trump was on the ballot. The pandemic might have been something that would have been advantageous to President Trump at that time. But by that point, it was not an advantage for him. So I think politics played a role there. We're not cherry picking examples, by the way. We take account of all the evidence that's available. Now, one country that took seriously its own pre-COVID pandemic plans and was predicted to have a disastrous COVID experience was Sweden, which emphasized voluntary measures, which never closed schools for kids under 16, and which they knew they would have, or they predicted that they would have somewhat higher deaths early on. Whether that was what that was due to is not 100% clear. They had a mild flu season the year before. But if Sweden was held out as a pariah state that was just behaving in a crazy way, well, it turns out that after a year, just as the public health officials there had predicted, their death rates were quite comparable to those of their Nordic neighbors. And by some measures, by good measures, we think, Sweden seems to have had one of the best pandemic experiences in the world without the kind of costs that were borne in countries that had much more extended business closures and school closures. So if we learn from experience, I think the one thing that we should learn is greater humility and doubt about measures that were kept in place in many blue states for a very long period of time when there were things to be learned and there was a wider debate to be had. We point out in the book, Graham Allison, a great scholar of crisis decision-making, argued in April 2020 that we were not having a sufficient debate, that we needed a team B, we needed devil's advocates. Now he's operating from Massachusetts and so from a very blue state. But we do think there were not a sufficient accounting for the costs of these measures. We certainly quote Andrew Cuomo in the book saying that if everything they do saves just one life, that'll be worth it, with no accounting of the cost of the measures whatsoever.
I want to say I hear your frustration when you ask for solutions. But I think we also have to recognize that sometimes science and medicine does not have a solution to a problem. I mean, there are many medical conditions where we don't have a solution. And in fact, we demand that countermeasures taken against these conditions have to be held up to standards of safety and efficacy. I think that same kind of reasoning needs to be applied in public health as well. That we have to show that measures are efficacious and safe before we impose them on the whole of society. That there's
3,500 people were dying a day. Like, right, we don't have time so we just let them.
No, it's not a matter of that. The matters that the methods that we took may not have saved lives. Closing schools may not have done anything beneficial. There's no evidence that places that helped maintain school closures longer had better outcomes. That, you can rush headlong into taking measures that don't do any good and just compound the harm.
Every episode of Trade-Offs is grounded in rigorous research.
I don't think that the findings of this paper indicate that there are major clinical risks to patients.
Thoughtful conversations.
I also was thinking that a lot of the anger, while real, is somewhat misplaced.
And insights into what the latest in health policy means for you.
And every member of Congress should be asking questions on both sides of the aisle about, hey, we're spending hundreds of billions of dollars. What are we getting for it?
We tell stories that cut through the noise, uncovering the data and personal stories that help you understand the stakes and the potential solutions to healthcare's toughest choices. Subscribe to Trade-Offs wherever you get your podcasts.
I want to move us here because in some respects, you guys are political scientists, and it's hard to disaggregate COVID-19 from the moment in which COVID happened, right? Where you did not have leadership that was trusted or leadership that had demonstrated its commitment to evidence in any real way. And I think for a lot of folks, there was a level of fear that was doubly imposed by the fact that we were walking into a pandemic where thousands of people were dying a day, and we did not have confidence in the leadership that the country was displaying, and there was very, very clear disagreement and disjunctedness in that leadership. And I want to ask you just to reflect on what that context may have meant for our ability to have a rational, well thought out conversation. Because when you have a politician at the lead of the country who says that the most important question here is really about the stock market and not the thousands of people who are dying, it does cast some aspersions about efforts to make an evidence-based argument that might pull up on these kinds of interventions, right? Because that doesn't necessarily represent our best interests. It's not to say that there aren't economic consequences to lockdowns that are serious and should be taken seriously, but that is to say that when you operationalize them through the stock market as a function of what you think you're going to do in the next election, that does sort of force one to ask what your priors and your goals are here, and does shake confidence. So how do you all think about that? Do you think that we might have had a different more rational argument if people trusted that leadership took their best interest and not their political outcomes most seriously?
One might say that the United States confronted the pandemic amidst a whole host of pre-existing conditions. That we were led at the national level by a president who had low public approval, who was distrusted by more than half of the country even before the outbreak. And then he conducted himself in ways that did not improve confidence. He would go out on a daily basis, do at those press conferences, and it was clear he was improvising. And so this was not confidence inspiring. It was just on the heels of a presidential impeachment. And we had the election year. There was an election coming up in November, and so we had to confront that and all the polarization that happens around an election. And so all of that, I think, undercut the capacity of leaders to reassure the public or to conduct themselves in ways that could increase public confidence from where it was at the start of that outbreak, which was already low. So it was a very difficult set of circumstances where we had to cope with this crisis. Now, Congress came together remarkably well. The passage of the CARES Act merely weeks after the initial lockdowns were recommended in mid-March. Congress came together and passed a more than $2 trillion package to help to provide for the vaccine development and distribution, to help jumpstart that process, to sustain people through the closures, to both checks immediately as well as by historical standards a very generous pandemic unemployment benefit. Generous funding to help small businesses get through the crisis. So Congress really stepped up to help early on, but that didn't negate the ongoing polarization that unfolded over the course of the summer and the subsequent year around the pandemic.
We do think that Trump was extremely unhelpful, to say the least, during the pandemic. But it was also a mistake to assume that the truth was always the opposite of what he was saying. Yeah. Simply because he's made rude remarks about the China virus and so on, does not mean that it was wrong to suspect that the virus that originated in Wuhan might have had something to do with the lab in Wuhan that studies those very same viruses and makes them more dangerous. The herd effect against sort of Trump on that, which turns out to have been orchestrated in part by public officials who were responsible for funding some adjacent research in that very lab, it was itself a kind of emblematic of the ways in which people were unwilling to ask questions once there was an establishment narrative that had been set. I know that that's not where you all want to go in terms of a topic, but there was way too much polarization on both sides. And the White House was mainly in an advisory capacity. Policies were being made at the state level. And Trump actually never really countermanded the suggestions of Deborah Birx and Anthony Fauci. If you read her memoir and his memoir and so on, he made lots of remarks that were at odds with their messaging and recommendations. But he basically left them to do their work, moving around the country, recommending these various measures. So we do find him unhelpful. The country was subject to many pre-existing political conditions, but we need to be more careful ourselves to focus on our professional responsibilities towards evidence and to make sure that we're considering costs as well as hope for benefits from these kinds of measures.
Yeah, Stephen, I agree with you. And I actually made this mistake like in February of 2020, and I wrote about this and the lessons I learned during the pandemic, and that I initially dismissed the lab spillover theory because of the messenger, right? It was because of Trump. It was because it was wrapped up in other conspiracy theories. And in self-reflection, like as a scientist, I can do better than that. It's really hard to put those thoughts aside, but I agree. I mean, especially during an emergency, we're dealing with a lot of noise. We're not perfect, but I agree. That was at least something that I learned that I could do better. You know what, Stephen and Francis, one of the themes I heard you say repeatedly on this, as well as in the book, is something that I've also found a lot of frustration around, is that we haven't had like a 9/11 commission. Like we haven't had a nonpartisan, or maybe it's partisan, like I don't care, like anything to learn about the lessons, to understand, to hear about the families that lost 1.5 million people, to hear about a lot of the kids that may have done worse in school because their schools were locked down. The best thing I've seen is like the COVID Wars book, who was the author of the 9/11 Commission. I mean, what would you guys like to see?
I mean, one thing we'd like to see is more university conferences on these matters. You know, we're in the business of having, conversations, not just with academics, but with people like yourselves in public health, frontline practitioners, and so on. Francis and I did a workshop in April 2023, and we brought in some people. We found that people were not willing to come, who we invited, because they didn't want to have the conversation, which we find disappointing. It's still kind of remarkable that we're talking about the biggest global crisis since World War II, the worst pandemic in a century. And there needs to be open-minded, critical and self-critical discussion of these matters. We know of very few university conferences, no law school conferences on the impact on free speech principles of the, and Biden administration was intervening with social media companies secretly to suppress messaging at odds with government policies. Whatever one thinks about that as a constitutional matter, whether the Supreme Court should have come to a different decision there, it's a matter of constitutional concern. And yet we know of no law school conferences taking place on the free speech aspects of those Biden administration policies. So there needs to be a much more open, wider, nonpartisan, as you say, fair-minded series of conversations.
Like, yeah, maybe at academic institutions. The thing that I've actually do appreciate is some states have done this, like New Jersey had an entire kind of report out of it. I mean, there just doesn't seem to be any political push to do something like this. I'll tell you, I'll be honest too. Like I've been invited to some of these conferences and it doesn't seem like it's a good faith effort a lot of the time too. I mean, I'm down to have really hard conversations and do a lot of self-reflection and figure out how to do better next time, because there's going to be another next time. The challenge is finding a space where it's mutually respected, that there's listening on both sides, and that something's going to be done about it too. And Braver Angels has started trying to do something like this, but I've been very disappointed about the lack of lessons learned. I think a lot of us all deserve it. I mean, I was working 100 hours a week, like I deserve that. So I guess that's just a comment of reflection.
I think it's becoming increasingly possible to have these conversations. I mean, this is a point on which Steve and I differed as we were working on the book. I was always very pessimistic that anyone would even want to read this book that we were working.
She was very pessimistic.
And yet here we are, we're having this conversation. This is sort of like beyond what I expected. So I'm very happy that we are able to have this conversation. And I think, that these sorts of conversations in society, I think can play the kind of role that we need. We may not be able to have a formal 9/11 style commission. And I think that there is, as you point out, a lack of political will to convene a commission like that. And I think part of the story is that all public officials feel implicated in some way, that I don't think there's any public official out there who feels that they got it all right. And so they don't they don't have much incentive to engage. But for policy professionals, for academics, I think we can have a more rational discussion than policymakers who feel very much on the line. I mean, the consequences of the decisions that were made in the pandemic were so large, and that if they were wrong, this is not something that policymakers are going to be able to acknowledge. And so I think that's why they have had every incentive to turn away from it. But for those of us who want to understand, what happened and why, and how we could approach a crisis like this better in the future, it's really incumbent more on us than on the people who were in the hot seat at the time as elected officials.
Yes, I agree with that. And, we've gotten the pushback from some folks, not from you all, that, are you worried about your book coming out at this time when science and public health and universities are under attack, political attack? And we have worried about that in some ways, but it's a premise, of those attacks that science and universities are politicized. And if we don't have these conversations, then we just kind of prove that premise true. Only by asking these hard questions, by thinking about what we did right, what we did wrong, what we didn't know, what we could have known, how we might do better, can we kind of show that we're more than just political institutions with science degrees, medical degrees, and PhDs and so on. So we think it's very important to have these conversations, and we'd be delighted to carry it forward with you all in some fashion. It's too important not to learn from the experience that we had.
I think that's right. And, I think the hard part is it's very difficult to find spaces for a good faith conversation where context is offered for every statement made, because it's way too easy to clip any one piece out of context and then stylize it as the most extreme version, right? To be able to either rile up your base or piss off somebody else's, right? And we really appreciate you being willing to come here and talk a bit more about your book. I think the mark of a great piece of content is not necessarily that you agree with it, but that it forces you to think. And I know that this is way too short a time to really dig as deep as we would have liked. And there are certainly pieces that we are probably going to have to agree to disagree on. But I think the broader source of agreement that we have is that we need to be able to have these conversations before the next set of decisions get made. And, I think being able to engage, to assess, and to interrogate leads to better decisions beforehand. And I really wish that we'd had the opportunity to do that before. I worry, to your point, Stephen, that a lot of the infrastructure, the institutions that should be the place for that are being gutted. And I appreciate you making the point that we have to stick to our principles regardless. So we appreciate you taking the time to join us. Our guests today are Professors Francis Lee and Professor Stephen Macedo. They are authors of the book In COVID's Wake. Katelyn, thank you for joining me for this interview today. I think it was a really thoughtful engagement with a really important topic. So thank you all for making the time.
Thank you very much. We really appreciate it.
Thank you.
That's it for today. You can find more content at our website, incisionmedia.co, and check out our shop at store.americadissected.com for our new America Dissected merch, including logo shirts, hoodies, and mugs. And don't miss out on our Make America Scientific Again caps. If you have guest recommendations for the show, send us an email at info@incisionmedia.co. You can follow or subscribe to America Dissected on your favorite podcast platform and on YouTube at America Dissected. And you can follow me on Instagram, TikTok, and Twitter at Abdul no dash. And make sure you subscribe to Katelyn's incredible newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 followers. Search for Your Local Epidemiologist on Substack. Links to our sponsors are available in the show notes. Please do check them out and show them some love. They make the show possible every week. Finally, on your way out, don't forget to leave us a 5-star review. If you're watching on YouTube, drop us a like or a comment, and word of mouth still goes a really long way, even in this online era. So, if you know somebody who wants to have a conversation about everything relevant to health, you know where to send them. America Dissected is a product of Incision Media. Our co-host is Dr. Katelyn Jetelina. Our producer is Andy Gardner-Bernstein. Video and audio editing by Nadine Melkonian. Our theme song is by Taka Suzawa and Alex Uguera. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Our executive producers are Tara Knight and me, Dr. Abdul your host. Thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice and should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.